If you're dealing with a tight chronic neck, especially the SCM, and you've done all the side bending stretching exercises out there with little to no results, then this is for you. In this video, I want to share one key concept that you might be missing that's holding you back from long-term mobility improvements.
So when it comes to maximizing our neck stretch, specifically for that SCM, I think it's super valuable to really understand the anatomy. In addition, the one missing factor that so many of us overlook, it really is critical to understand the anatomy to understand that component. And we're going to talk about that in a second. But before we jump into that, let's just briefly review the basic anatomy. So the SCM, or the sternocleidomastoid, has two components as the name suggests. We have the manubrium or sternal aspect running up to the temporal bone, as you can see highlighted here. And then we have the clavicle bone, or the clavicular aspect, running from clavicle bone up into the temporal bone. And the traditional thought process is side bending or laterally flexing the head is going to get that to stretch. Now, that's great. That's kind of thinking two-dimensionally. I want to bring this up three-dimensionally and really talk about the key component to maximizing this, to getting more bang for your buck. The origins, meaning the clavicle and the sternum, are in super important places and have a major role with respiration, right? Respiration is that missing piece. Once we're in that laterally flexed side bent position, we then can start to use breathing to improve that stretch, but also to start to change patterns. This muscle is not used to being in a lengthened position when we go through respiration. A lot of people dealing with neck pain have super tight, compressed SCMs. And so we're starting to retrain a pattern. And that's part of this process of really including respiration into the stretch. So what I want you to envision, and what I can do is actually draw it in for you. I want you to envision that as we're going through a exhalation, we need the clavicle and the sternum to go in this direction, right? It needs to depress down. Now you can see we have the temporal bone attachment points, and that's not going to move. But if we take a good exhale, we get a massive amount of depression or stretch all through this SCM. Now here's the critical piece. It's the inhale. As we inhale, we do not want to go in this direction, as you can see by the dotted line. We do not want to go up. That's not creating change. We want to create change in our patient's pattern. So going and inhaling in a way that we're going into the shoulder shrug position is reinforcing the bad habit. That's what's keeping this SCM compressed and a problem. So when we're in a laterally flexed position, i.e. stretching the SCM, when we take that inhale, we actually need to move in this way. This arrow here is the way we need to expand. What is that doing? Well, the sternum is also known as the pump handle. And what's happening is as we expand, or as we inhale, I should say, we expand this way, right here, not this way. What that's going to do is set you up for then another exhale. But here's the thing, you didn't shrug back up. So as you exhale, you're going to continue to descend, and in between that is the SCM. That's how we start to get a bigger and bigger stretch on the SCM. And again, yes, the stretch is great, but the big bang for your buck is that we're starting to recreate a pattern. The pattern is teaching that patient how to not breathe with the SCM. Because if you pull through the weeds and look at the root cause, the root problem, what you'll find is that the SCM is tight because it's on 24/7 every breath that the patient is taking. So again, getting it in an elongated, eccentric position allows them to actually start to tap into their diaphragm. Once we can start to train this, then that neck doesn't have to be on every breath that we're taking. That's how we start to really maximize our SCM, lateral flexed neck stretch, but also start to change a long-term pattern in our patients.
So we now better understand the anatomy and can take a look on the skeleton. We can use the green band to represent the SCM. So with the traditional side bending stretch, as the patient moves their head away, yes, they do get a stretch, but that's where it stops. Remember, we should strive to be in the pattern changing game. This means that this stretch should ultimately have a higher purpose, and that purpose is to change a pattern, aka how this person's breathing. Because 9 times out of 10, they're going to be short and tight here because they're using those muscles all day long to breathe. So again, as we exhale, when we're in a side bent position, we need to get the clavicle and the sternum, the bucket handle to go down. As we then inhale, if I turn him around, what's going to happen is we should get this expansion here, not here. Coming up is going to keep that person in the same pattern. Going out is where they have that paradigm shift. So again, that's what we're looking for when it comes to our side bending stretch exercise. And if that happens with the breathing, then the muscle will continue to stretch and stretch and stretch because the respiration mechanics are correct. That's the game-changing pattern change. So instead of the traditional version of a seated neck stretch where we're either passively going into that motion or actively, I like to do this on the cable machine. What I find is that it really improves our ability to get that depression so that then we can put our patients in a position where they're successful and then really work on the breathing, right? So what you're going to want to do is put the pin on the heaviest position. That way this doesn't move at all. And from here, it's pretty simple, but I always tell patients that they really need to go in a systematized way. What I mean is that a lot of times they just want to go through all the motions together. This can be a relatively vulnerable area, and so we want to go into it with a little bit of caution to make sure we don't get any sort of nerve irritation, right? So all we're going to do is we're going to grab the handle. We're going to first lean away, and the first lean should start to depress that right shoulder in this instance. As I feel that start to stretch, I'm then going to laterally flex the head. Now, to get that pure lateral flexion, I always tell people to pick a point on the wall or anywhere in front of them and to try to keep that position, and that usually helps them avoid either rotating or shrugging. And so it's just more of that pivot point. So from here, they're going to laterally flex. I already feel a nice stretch to the right SCM. I get the shoulder, the biceps, the upper trap. There's a lot going on. From here, all we're then going to do are 4 breaths. So all we would do is inhale through our nose. As we exhale, we're exhaling until we feel the ribs go down. Another way you can cue this to your patient is that they must feel an increase in their stretch on the exhale. That means that they did it successfully. If they take an exhale and did not feel an increase in stretch, that tells you that their ribs did not drop down, right? Because the SCM is in between. It has to follow the ribs if the ribs move enough, right? So then we would continue that pattern. So as you inhale, we're trying to get air this way, not shrugging up, and then we try to exhale more. So the goal is by 4 breaths, the ribs should be at the furthest point, right? And the stretch should be more intense by that 4th breath compared to any of the previous ones. This would all be good indications that they did it the correct way.